And thanks for staying with us. We're taking your questions now for veterinarian David Graff. 365-9999 is the number to call. And Nancy is waiting on the line with our first question today. Go ahead, Nancy. Nancy, can you hear us? Okay, we're going to work on getting her back on the line, but you brought a friendly cat with you here
Yes,
today.
his name is Meriweather. He's a young neutered male. He's out at the Cedar Rapids Animal Care and Control, and he's real friendly.
Yeah, pretty chill cat, just kind of hanging out. One of the things that you wanted to talk to us today about is bladder stones.
Yeah, if you see blood in your pet's urine, it could be dog or cat. In the winter with snow, people see blood in their dog's urine when they take them outside. It could indicate stones in the bladder. And of course, it could indicate a lot of other things too. Urinary infections, but of various types. But I did a surgery yesterday where we had a little Yorkshire Terrier that had numerous bladder stones that were removed. And frequently, the only way you're going to get that diagnosed properly is with x-rays. So a urinalysis won't always direct you to that. But a urinalysis is done and x-rays are done. And this little Yorkie had surgery to remove the stones. And an important thing to understand is if you don't change the lifestyle of the pet, probably the diet's the most important thing to look at, the stones will almost always come back. And that's why it's important to understand that we're going to have to change things. We're going to have to get more water into this pet, and especially we're going to have to be on a diet that prevents the recurrence of these stones. And there's two major kinds of stones, and ironically, if you try to prevent one, you can accidentally cause the other. So it's monitoring after the stones are removed to make sure that there's no crystals in the urine and that the pH is correct to prevent recurrence of those stones.
Is that something you need to get tested then regularly after the first?
Yeah, every few months.
And are there any other symptoms other than blood that would trigger this?
Straining to urinate. And then another thing that happens frequently is there'll be a diagnosis of urinary tract infection. They're put on antibacterials. After a couple of weeks, they're better, and then after a couple of weeks, it comes right back. This can be an indicator that there may be something else going on in that bladder. Could be bladder stones causing this. So
need surgery to take care of that.
Need to take a look at that, x-rays.
Great. Okay, Kimberly is waiting on the line with a question. Go ahead, Kimberly.
Yeah, hi. I've got a 10-year-old male chihuahua, and he's always been kind of hairless on his belly. But as he's aging, he's getting more hairless. It's just creeping up, and he doesn't itch or lick, so I don't think there's anything like that going on. But is that a chihuahua trait? Or? Well,
those little guys don't have much hair to begin with, and they're cold all the time, and they like to wear sweaters a lot. Older dogs may have hypothyroidism as a common problem, and that causes less hair growth. So that's very easy to test for. It's a simple blood test. So you probably need to have your chihuahua tested for hypothyroidism. If he does have it, then it's easy to treat with thyroid supplement tablets that you take several times a day.
Good to know. And if you're interested, again, in adopting Meriweather, he's available at Cedar Rapids Animal Care and Control. Dr. Graff, thank you so much for coming in today. We appreciate it.
Thank you.
And coming up tomorrow, our financial expert will be here to talk about last-minute tax tips. That day is approaching. Stay with us. Another check of your forecast when we come back.